because when we talk about placement of future parks, that can be a bit of a challenge. People crossing a major highway is actually quite a psychological deterrent for people to travel to a park. And then between Kelly and East Arcadia, it actually is not 16 miles apart, but that's how far it is when you have to drive from one place to the other, because there is no direct route between the two towns. So the recommendations then relative to the facilities, based on all the information that we gathered over that year period, is a need to develop some satellite parks in communities. And looking at prioritization is going to be something that the Parks and Rec Department, along with y'all and some of the other folks in the county, to look at in terms of where the greatest needs are. One of the things in terms of what we heard from the public that we have to bear in mind is we did not have a fully random sample. The surveys were open to everybody in the county. We publicized it in Blake Online, we publicized it in the journal, we had it on the website, we had it on people's utility bills. It was all over the place, but nonetheless, some people participated, some people did not. So we certainly heard from people who had the biggest concerns about having access to parks in their area. Playgrounds for youth, children, and toddlers using universal design principles. Universal design principles are related to ADA accessibility, but it goes beyond that as well. But it meets all the ADA accessibility compliance issues. And then creating some tot lots, mini parks, and playgrounds. So these are just a couple of pictures. The mini parks and tot lots you see on the left-hand side of the screen. Those are just some examples of the size of a park that a community could very well suit one of the communities you've got here. So we're not talking about parks that have acres and acres of land necessarily, but parks rather that have facilities that will be usable and desirable by people who are living in those communities. We're real good, not only in this county, but across the country, with having playgrounds for kids between 5 and 12 years old. We're not so good with having playgrounds with children younger than that, or with kids who would be in that tween age. And yet there are playgrounds for different age groups. So part of what I showed here as well are playgrounds that would be for all age groups. The one on the right shows some pictures of youth playgrounds, not here in North Carolina, but they are elsewhere. They're dream parks, if you will, that these attract youth and young people, which is one of the things I know the county is looking for, is how to engage some of the kids who have aged out of programs by the time they reach their early teen years. So having areas in these outlying communities that allow for free play and so forth is something that's doable and certainly is desirable by folks in the communities.
What, you don't want to interrupt?
No, please.
What is the cost of something like that?
Yeah, good question. Playgrounds themselves can range from $100,000 to $500,000. The good news is, and Bladen County's been successful with this, there's a state grant program, the part of grant program. I'm not sure if you're familiar with that. Okay. And Bladen County's been successful in acquiring some of those grant funds. They remain not quite as rich as they used to be in the early years, but the funds are still available. There also are other providers, and I've identified some of them in the full report for y'all. I don't know if you're familiar with Kaboom. It's a playground construction company. The Trillium company has been very good with Eastern North Carolina in terms of providing some grant funding and so forth for different playgrounds. So there are a variety of sources out there, I think, that y'all would definitely want to be in touch with, and I think would be successful based on the people that you serve and where your needs are. Yeah, they can get pretty pricey. One of the other things that people asked for was parks that have natural spaces in them. Now, I just talked about doing little mini parks, because I think those are most doable in terms of providing services for the most number of people in the many rural areas that you have here. But nonetheless, natural space is something that people were asking for as well. Ensuring that there's lighting in Bladen County Park, adding a restroom facility near the picnic shelter. Don't know how familiar y'all are with Bladen County Park, last time you were out there, if you use the picnic shelter or not. But the picnic shelter is quite a ways away from the ball fields, which is where the restaurant is. And so for people to use the picnic shelter then, they would actually almost have to drive to get up to use the restrooms. So having something closer to the picnic shelter, I think, would provide a lot more access and use to the picnic shelter if people had that amenity. And then there were some ADA accessibility issues that needed to be attended to. Very few at Layton County Park, but certainly at the King Street Gym, and some of the equipment, if you will, the walking trail and so forth, that need some attention with that. Overall, ADA accessibility is pretty good, except for the gym. It's a pretty old facility, as you all are well aware. The programs right now are, for the most part, youth programs. You can see I've listed them there. Facility rentals, open gym time is also available, and adults participate in those more. But for the most part, the programs are for young people and they're sport-oriented. And a lot of what I heard from people who participated in the program is not everybody is interested in sport, not everybody has those skill levels. And what do we do for youngsters and seniors and teens who don't necessarily fit into those particular programs? So some of the recommendations were to partner with schools, county agencies, and so forth to try to create additional programming, because staffing-wise, Layton County Parks and Rec Department is pretty small in terms of the size of the jurisdiction that it covers. Layton County Park right now appears to be underutilized except when it's fall season. Fall season is a very busy place. People are there almost daily, fully engaged in using the facilities. But there's a lot of time when the park is not being fully utilized. So in terms of getting full access and also producing some revenue and drawing more people to the park so that other folks, 25% of county residents have never been there, could be something to draw people to the park and be a revenue producer as well. So a programmatic aspect to consider. Looking at programs that are not necessarily sport specific, a lot of people talked about wanting parks to have facilities that were health and wellness oriented. Walking trails were something people mentioned a lot, making sure that they're accessible so that people with strollers or people using wheelchairs or any other ambulatory aids would have free access to those. But a lot of people talked about parks being something for health and wellness. And that is true, they are, if we can provide them close enough where people can actually access the facilities. One of the unique things that could be done in addition to providing on-the-ground facilities like parks is recreation programming. And again, with the outlying communities, having staff in all those communities is nearly impossible in terms of the size of the county and so forth. But there are mobile recreation programs. I actually, when I was working on my graduate degree, was a person who was responsible for mobile recreation programs, and every day of the week I was in a different, very small community, my car full of balls and equipment and so forth, and I went from community to community providing recreation programs. So that's the type of thing we're talking about that might be able to get programs out to the people, since it can be a real challenge to get everybody into Layton County Park. Looking at adding summer camp program for youth, using teens as counselors and as helpers, adding programs for seniors and people with disabilities. These were the three areas that people talked about being in deepest need of having programs and services and facilities available. And then other recommendations, updating the webpage. This county is rich in natural resources, outdoor recreation resources, cultural resources, and I think those could really be marketed, if you will, as something that could draw people and engage them in different types of recreation activities. Communication efforts with marketing and so forth, letting folks know about the outdoor recreation and natural resource-based opportunities, because you have so many state facilities in this county. And I didn't want to take up a lot of your time, so I'm open to any questions that you don't want to have.
This is to Mr. Page. I've listened to some of the assessment that she gave us on where we need to locate facilities and what needs to happen with facilities. And then we looked at, had that discussion with you in the prior meeting about trying to do some things, and you said to be a part of your program outlay that your comprehensive plan is putting together now. My question is, can you work in conjunction if we go to and find communities like she was saying we need to be in certain areas? If we took the funding that we had now that we have appropriated, and for you to work in conjunction with them to try and facilitate how to put parks, if they come in and ask us for some of this specific funding to deal with those outlying areas where we need recreation? Can that be a part of that grant program?
The first obstacle in all of it is nothing is defined on where.
Okay.
That's a big question, and that won't be a me answer, that'll be a group answer.
Okay.
Are you asking, can I go out and physically put boots on the ground?
I'm asking that the community wants a facility, some type of recreational need that they not accessible to. Could they come to you and work in conjunction with you to deal with the park grant, that grant piece, to try to develop what they gotta, how that piece of that comprehensive plan, that's what I'm saying.
The grant is for municipalities and local governments. I'd have to do some research on that. It'd have to, depending on where it was at in the county, and if the county was gonna take over maintenance responsibilities, there's all kind of questions associated with
So some of that will have to be,
Individual and.
the individual ways from the
Yeah,
handled.
they will have
I
to
was
be
trying to figure out what the
But I would
logistics.
help them any way I can as far as planning and give them some, all of our resources would be at their disposal to help them. We would never just say, you don't get on.
I was looking at the logistics of who would need to put things in certain places, that's what I'm talking about, this is the logistics of it, where they would need to go. Because she was looking at, that was a concern we had, that people don't have access to recreational needs. And I'm just trying to figure out how can we implement something with this comprehensive plan that would run in conjunction with what you're trying to do.
And that's where the plan, it's kind of, Bladen County's a big area, and that's the where is the deal.
So, 206 people took the survey.
Took the paper survey, yeah, or
So
paper online
is that
survey.
even enough data points to get any kind of correct data?
It does. The problem is that it's not random.
30-some thousand?
Correct. The problem is that because it's not random, because we don't know why people did not participate, so there could very well be that they didn't find they were being heard or
Right.
whatnot.
It does appear to me that that's enough people to get a true picture of what the problem is. For instance, like I think we spend $1/3 million in recreation right now. And I know the health department does walking trails, I know towns have walking trails, and I know we have schools in these communities. And nothing against the recreation department, but maybe they need more resources, maybe that's where we need to be reaching out to get grants and more help so that we can utilize what's already there.
Sure.
We started some program 2 years ago. I mean, there's a lot of resources that's already in place, we just need to reach out and revise them.
Our biggest part, manpower, I mean, when you start, the county is huge, when you start getting out.
You can't do it.
Well, I mean, that's the only way you can do it, you can't focus all your manpower on the county park and it's not being utilized. But that's what she said, there's times when it's not even being utilized, so that's when the resources need to be transferred.
And I understand, and to that point, the three folks, the full-time folks in our department, if the grass don't get cut, people see that. So that, when you gotta have your coordinator out there maintaining grass and a director that's where it runs.
Well, we got inmate labor. I mean, I'm not here to be critical, I'm just saying, I think there's a lot of things already in place in this county that we could capitalize on that we as county commissioners are not doing. I just put it on us, I ain't gonna put it on nobody else but us. There's a lot of things that we could be doing. I know Mary Ann does walking trails and stuff like that, and I know that they're in just about every community.
At every park, you would want a walking trail, if you had it.
The reason I'm asking the question about logistic wise and supporting other communities is I look at the town of Elizabethtown get $500,000, $700 million to go out there and develop Cape Fear Winery. They said they're gonna invest $500,000, $700,000 out there to put a walking trail, a pond, and some breeze walks or something to walk on put out there. They go to Torrey Hole and they do the same thing. And I'm asking, if those funds are available, can't we start trying to assist communities to get that kind of stuff? Maybe in that, the grant, you put your own manpower into the hands of the
Well,
city.
with the right situation, and yes, sir, we can do
That's what I'm saying.
anything, I'm at the pleasure of the board, whatever.
That's the thing I'm saying. Why don't we start seeking, they can come in and get millions of dollars, and build parks all over the place. And we sitting here can't build a baseball field.
The park that you're speaking over at the winery, I think they use some of the property value to, help them with that money, so that, the property was, they used that as some of their max, so that was.
That's what I'm saying, how can we get that information to some of these communities so they can do the same in kind? And see, can they figure out how to get some of these things done? If those resources are available, and those avenues are
I
available.
would glad to
I'm
do
looking at
it,
it.
yeah, I would.
You probably get front tax.
Well, my response to that is that, you got to have communities, you've got to have municipalities that want to do it. And this town just has to happen to be proactive, and it shouldn't be critical or criticize of what they're doing. I wish other communities would take the initiative this town has taken to do some of this stuff. Blainburg just got a part of grant. I mean, these towns can do it. I mean, it's not the county's responsibility to put parks in these towns.
But some of them don't have the resources and the know-how to even know how the park grant work. That's what I'm asking.
But not
He
only that,
knows how this
they
stuff
have
works.
economic, base. When you go have some of these small municipals, they don't have an economic base. There are no jobs, there are no business there to give any resources, no dollars. The best thing they can do is get donations and folks to do fundraising. And I agree with, I was not aware of, Trilogy or some of these other places, but if the grants are there, all you need is a list, and we need the data from you, from these outlying, municipals. East Arcade, White Oak, wherever, we can help, I think, but you need help, like he's saying.
I would be glad
It's
to
tough.
meet with
We need the data.
any community, because when this is approved, they can piggyback off of it.
That's
This
what we
is
need,
a
the data,
plan.
that's what I'm talking about.
That's what I'm
That's the
saying.
data,
They can piggyback off of this to use it.
that's it.
get funded.
That's
That's
what I'm
right.
saying. And that would cut some of our resourcing costs. You figure out how to get rid of
But it's
that.
gonna be, but it's still gonna be, most of the, grants that I've looked, they're saying max, you have to have maximum dollars.
That's where I can't speak for that.
I got you.
They could be in-kind matching.
Right,
Or
some
some
of it is.
But they need to be aware, these
That's right.
things are here. Some of them don't know those things are available.
Well, then the leadership of these municipalities need to be educated. I agree with that, but part of the grant is not nothing just started yesterday. These grants have been there for years and years and years.
And as long
And
as
some
I
of them
can
direct their initiative to come ask, and you can't spoon feed them.
I'm saying, we as a county, getting ready to look at a comprehensive plan that tells us that we need all these things. If we know we need all these things, then we need to make some kind of proactive statement or movement to start trying to implement some of it. That's all I'm saying. You said they're gonna approve a comprehensive plan that tell you need all these things, and we will sit here and do nothing.
I didn't say do nothing. We're gonna be proactive, but we need to put it on to the municipalities, not take county tax dollars and subsidize, municipalities to start a facility.
Are any tax dollars used to the current parks?
Yeah,
Any dollars?
$1/3
For the local parks here in Elizabethtown, that people, 6% of the people cannot even go to, because they can't walk to. So you talk about that amount of money, and you're saying, but the other municipals cannot ask for dollars? That's hypocritical, don't you think?
No, I don't think so.
Oh, of course it's you.
I will say, when the Bladen County Park was established in 1979, it was a regional park concept.
Okay.
Being a rural county with not a whole lot of money, that's
Understand.
why it was established like the park.
But even now, it's been putting dollars to improve it, and we need to, because people in Elizabethtown and the outside county, they need it too. So I'm not saying they don't need it, but I'm telling you that other residents of Bladen County that pay taxes should benefit as well. That's all I'm saying.
How much did this park recreation grant that cost us to have implemented this comprehensive plan, what would it cost on it?
This plan,
Yeah, did it cost anything?
the original plan, when we did this 10 years ago, it was around $27,000. To update this plan, it's $12,500. And that is really, really a good price considering.
Okay, the only reason I brought the question up is, we gonna spend $12,000 for her to give us a comprehensive plan. And just approve it tonight, and say, okay, you can agree along with it. What's gonna be the solution, and what we're gonna do with the plan? That's my
I'm still at the pleasure of the board of what I can and I can't do.
Well, I think the main thing, like, with any of these
That will be the Bible right there for you to take.
That is our map for
is
10
to
years.
generate awareness.
Go ahead.
For myself, I
Mr.
had no
Well, I'm
idea.
Chair recognizes Mr. Bullock at this time.
What I would suggest that you, if possible, that you two could get together and call the municipalities together and kind of enlighten them on what your report is, and also other sources out there for income that they could use to create recreational park. So it'd be a good idea to enlighten all the municipalities on your report.
This will be Dr. Jordan's, I hope, maybe the last visit here. I mean, I would be glad to help. I went to the Rotary Club in Bladenboro this time. I mean, I'll do any of that, go to any of the civic organizations. speak
Enlighten them
about
on what you got.
I just wanna know why we spending $12,000, what's the benefit of $12,000?
Well,
Oh,
if
wait a
you,
minute.
the part of grant,
You voted for it.
So, then I'm asking, what we get for it?
the part of grant that we apply for that has been spoken about, it's on a point scale. Without this piece of paper right here, this is a big point, this is big points on that part.
Okay, that's why I want to know, what we get for $12,000?
And that's an instructional guide, basically too. I mean, that's your layout, your format, to proceed and go forward and apply and to do.
In an overall.
And let's give credit where credit's due. Give Elizabethtown credit for having the knowledge to hire somebody like Eddie Madden with the ability and the knowledge to know how to write a grant. It doesn't take any of us that can see just a little bit what's happened in this town in the last 8 years, and you got to give that man the credit, along with that board, that he can bring a lot to the table with his knowledge on grants and all. And that's just telling it like it is, and I think Grant would.
Let me add to that, I'm gonna pile on that. We are two totally different organizations with two different,
Exactly
we
right.
offer programs where the
Elizabethtown is
town is not.
Elizabethtown.
They're a facilitator. We are a Parks and Rec department.
That's
So
right.
we are, but I do, hats off, that they do a good
I
job.
mean, he does, you got to give credit where credit's due. And these other municipalities, you've got to go out and hire the same type of person to do the same. I mean, they got towns and they got administrative staff, and Elizabethtown just picked a good one to do the work, and they benefit from it. Anybody else?
One thing I'm just saying, one last thing, are they failing because of the lack of knowledge? Because they don't know, that's what I'm saying.
I can speak to you about, I have spoke with several folks from different municipalities. They are aware of this stuff.
That's what I'm saying.
They are aware of the park grant. They are aware of the same funding that we receive. I have spoke with several communities.
Thank you, Mr. Chair.
Big one.
We don't, just information.
Yeah, but just an action item, move on. Can I get a motion to approve the comprehensive, park plan development at East Carolina University?
I second, yes, I do.
Got a motion by Dr. Moore, and a second by Ms. Ashley Trivett. Any further discussion? All in favor say aye.
Aye.
Opposed? Thank you so much.
Thank you. Good job.
Appreciate your time.
Thank you so much.
Health and Human Resources. Wainwright.
Good evening.
Oh, I'm sorry. Okay.
You're fine. I'm Mary Valentiner, and this is Monique Trevise, and she's our new health educator at the health department. This is her first commissioner meeting as well. So, we're here tonight to present to you the State of the County Health Report. It is from 2017. It was approved, it was due, the first Monday in March, and it's due every year that we do not complete a community health assessment. However, we got put off due to approval from the state and that sort of thing, and then, the storm, all kind of things have come in the way of us getting here tonight. So, we're here tonight to present, and, this you've all seen before, but this is just a recap, and we update the data each year as the newest information is available to us. As you know, with the state, the most recent data for some of it is 2016. So, these are just a recap of our child priorities, and these were our community health assessment priorities: chronic disease, substance abuse under that, which is tobacco, vapor, alcohol, prescription drugs, and then our priority 2 was obesity, weight problems, and then our emergent issue from the 2015 child was the teenage pregnancy, and then we get the updated trend data. We do have a slide dedicated to that further on in the presentation. So we go through our top causes of death as well and update that data. as most recent when this document was completed. And that's the number one cause of death is heart disease. And the state rate and Bladen County rate has slightly decreased. As you can see, we're in the dark blue. Number two cause of death in our county was cancer. Here, we've gone down a little bit, as you can see. We're below the state rate, but smoking is still number one cause of cancer according to American Lung Association. We break it down here by type. You can see the highest as of 2016 range was 57.6 for trachea, bronchus, and lung cancer. So that was our top in the county for the cancer of all types, or different types. Number three cause of death, chronic lower respiratory disease, things like COPD, emphysema, bronchitis. We were at 44.3, the state was at 45.6. We're staying about the same on that, not a big change for either the state rate or the county rate. Am I going too fast? Okay. Number four cause of death, diabetes. We did go down on that number a little bit, which is always good news. 36.5. Cerebrovascular disease or stroke, we were at 37.3. We went down a lot actually from 43.2 prior to the 2015 data set. Number six, we threw this in there as far as like just other unintentional injuries popped up with some rates, and those would include falls, drownings, accidental gunfire, motor vehicle, and poisoning is how they list that category. And so that was at 39.1, and then, you know, we're kind of staying the same at that higher rate. The previous data set was 39.2. This is the more detailed look at teenage pregnancy from that 2015 CHA, and I gave the actual numbers, because sometimes rates are hard to look at and understand. For me, I will say, so I called the state and I was like, I want actual numbers to see what did we have for 2014, 15, and 16. So you can see those in that bottom blue chart there, and you can see where we spiked in 2014 to 51. So that affected our rate for that data set, which made it the emergent issue at the time that the document was completed, or the CHA was completed. So we did drop. We are going down. As you can see, here's the trend data. I felt better when I saw this chart because I was like, what is going on with our teenage pregnancy rates? And so they are going down. As you can see there, we're in the pink line. And that's from 2001 all the way to 2015. And I'm gonna let Monique talk about the new addition program.
Before you,
Sorry, yes.
you talked about your priorities for 2015.
Yes, ma'am.
So you developed those in 2015 for the next year?
What it is the community health assessment is a large document for us. And so those are developed, the priorities come from that document.
Okay.
So that's based on data from the state. And so we have to work off of that document. Every year, we have to submit some kind of document to the state. So 2015 was the last community health assessment, but those same priorities we look at and track with our state of the county health report, which is what this smaller document is.
And so that's why you pull in 16's data?
Yes,
But you
ma'am.
have nothing for 17 yet?
16 is the latest we have, even as of now.
16.
Yes,
Wow.
ma'am. They, the state is far behind with their data.
Okay.
November is typically the time when he said they were actually working on the 2017 data right now. I talked to him about a month ago, because we presented to, well, yeah, it was just before the storm. Because we presented to our advisory board, and I was getting those actual numbers for the teenage pregnancy. And, he said, I'm actually working on the 2017 data now, but it won't be back out till this fall, so.
And technology, we're supposed to get.
Yeah, I know, we get frustrated because by the time we get to you all, it seems really old. But you know, the trend data helps us see, you know, how we're doing over time. So they do have trend data for some of the information, but for not all of it. But yeah, we try to bring you the most. The state of the county health report goal is to keep that data updated. And we're in our cycle now for the community health assessment, so we'll be back here next year, presenting that large document to you all. So we'll have a different set of priorities.
So do you have your data though for Blaine County?
That's like, that's county level data for that, yes. But that's the most that we can get, because it's pulled from different, areas of the hospital or, depending on the death rates, so they collect all that through vital records and they send that to the state. So yeah, that's the most available data to us, thanks for this. Any other questions on the data?
One question, what do you contribute the reduction in the different categories? What do you contribute that to?
Well, we have programming, that's what she's getting ready to talk about. It's some of the programming that we have that's going on, and then some of that our collaborative partners have to help combat. And the sad part is, like I was telling her, these numbers we won't see for a couple of years for the current programs that are going on now. So we just keep plugging forward and using those programs to help treat those issues.
So it'll be a couple of years before you know the effectiveness.
Yeah, I mean, we can see local numbers, sometimes we can know, like, maybe at the health department that our rates are going down, for certain areas for things, but overall, as a county, we have to rely on that state data.
Thank you.
Okay.
All right, so this is the 2017 new and existing programming that we have going on in funding. The Healthy Communities Grant, Young Families Connect Grant, although that one did end in 2017. The Medication Assistance Program, and then the Diabetes Prevention Program. And this slide is a list of programs that address what the community has identified as our health issues, which were aligned with our priorities as well, which substance abuse and obesity. We have the GREAT program, which is implemented in our school systems. We have the Operation Medicine Drop, that's part of Safe Kids Bladen. The Healthy Corner Store Initiative, drug awareness programs such as the Generation RX and PAC 360, and then we also have the Bladen County Opioid Task Force, which Marianne and I are both active members on. That was formed in 2017, and that combats our ongoing opioid epidemic that we have. We do a lot of outreach to show people the effects of opioid on families, and then we also do treatment or help people who have been affected with treatment plans or given treatment. Any questions about programming?
Programming, is one concern for the programming that is it available, can it be implemented is the one, I hear a lot of seniors having a lot of concern with medication. Like getting insulin, getting the proper medication and being able to buy it. People, when they run into a lot of problems trying to get medication. Do we have any program in place
I know
to
that.
assist people with those type of things?
Right, I know the medication assistance program, I don't know if they cover insulin costs but I know that they are housed in the Division on Aging building, and they provide people with assistance in getting medications. I don't know if insulin is one of those, but I know that is expensive.
Yeah, that's what I heard a lady tell me, she needs
Right.
$200, and she's on fix
There's an there's an application process that they will present to the medication assistance program or the Division on Aging, that they can help them complete the paperwork. And what Ruth Huggins, who is the nurse in that program, she researches and finds the medications to get them the assistance that they need at no cost to the individual.
I need to go to Division of Aging.
Yes, sir.
Okay.
Yeah,
I can give you their number. It is 872-6343.
634.
Yes, sir. And usually Elizabeth Lewis, if she's there, because they are on a part-time basis, Mr.
What's
Cox.
that name again?
Elizabeth Lewis, and they are on a part-time basis. So if there is no answer, please leave them a message and they will certainly get back with you.
Okay, thank you.
Yes, sir.
Under community health concerns, with children with special needs, would that fit on there?
How these were brought about, we listed the programs, it could fit under there. We didn't really have that pop up in that survey, for the last community health assessment. So what the community were saying to us in that survey response was that substance abuse was like a high priority for them, a main concern. So we listed programs that addressed substance abuse. Now, I will tell you, we have a front and back survey, just because we know that sometimes people fill out a shorter survey better. But this one that we are partnering with Cape Fear Valley and East Carolina University on as a regional community health assessment approach, it is a much longer survey. So we're probably gonna get you know, more information as far as like special needs, concerns with that feedback. So I'm excited to see, you know, what we did get. We had less participants just because I feel like it was a longer survey. People were complaining that it was too long, but then at the same time, it's a catch-22, you know, you've got to get the data that you need too. So, but yes, that is a concern, and we have, Innovative Approaches, who's been very instrumental in our county as well, you know, for children with special needs. So it's on our radar, and she's a part of our collaborative group, and we always keep that on the forefront, but it did not come out in this 2015 community health assessment. Any other questions?
Thank you.
Okay, thank you. We'll be back next week.
Mr. Chairman, on your report here, the health department give you sort of a snapshot of what's going on in our vector control program. And we began spraying for mosquitoes last Tuesday, the 25th, and we had 5 chemical sprayers and 3 are currently working. And I think they're working on the others as well. I think Corey and them sprayed about 140 gallons of product so far, and they've got 160 gallons on hand at the present time. We put out a public services announcements released on the 25th and 26th last week, instructing the public to tip and toss to try to get rid of any, you know, flower pots, tires, things like that just harbor and breed mosquitoes, and that can help us a lot. So we'll try to keep that PSAs going on that. We also advised in the PSA what harm that mosquito spraying might cause to bees and beekeepers. We have to be sensitive to that, and that every effort is being made to identify all the beekeepers across the county. So when we're doing strategic or specific spraying, trying to avoid those areas. Also, we announced that mosquito dumps were available free of charge at the health department at the front desk, and I think we've ordered another supply of those. So we want to make sure plenty of those are available. That's another way that the general public can help us out and help fight mosquitoes. Also, one of the more recent things we've become aware of, when you talked about broad spraying, trying to spray the entire county, is organic gardening and organic farming. From what I understand, once you spray that, the chemicals that we use, that ground's pretty much dead for like 3 to 5 years, from what I understand, before they can revisit. So to do, you know, that'd be ideal to have, you know, overfly and do the entire county, but in order to try to avoid those areas, it'd be almost impossible. We had looked at state assistance, and through the agreement and then the release last week, we understand that the county, out of a $4 million allocation that we're getting, Layton County's getting $39,845.
Question I have with that, and we're the 4th largest county in the 29 counties, how did they determine the 39 out of 4 million? I don't know a whole lot, they do math a little bit better than that.
There's a 1 o'clock call every day, and the one on last Friday I was on, I asked that very question, and I don't have an answer yet. The methodology that they use. Someone else.
I did speak with Dr. Cohen today, who's the Director of the Department of Health and Human Services. They're supposed to send an email with that information, but she basically indicated that it sounded like population density was a big factor. And so, as you know, we have a very sparse population density.
Yeah, when I sent those numbers, I called Senator Raven, and he said in Raleigh today, and he's gonna find out how in the world we got what we got. So I'm waiting on a call from Senator Raven for some explanation, but he told like he's gonna be raising sand in Raleigh today.
Can I add one person on something, just so people won't get the wrong thing? I've heard people saying, put Clorox, I'm just asking a question, and you guys see where Clorox kill mosquitoes.
I can't say yes or no. I've heard people tell me they've been putting pool shots. Like one gentleman that worked for the county was flooded real bad on his farm, and he was putting shock in there, and it was killing him. But what most people don't realize is the mosquitoes that are giving us problems right now, they came from Matthew. These eggs, they laid their eggs during the flood waters. The waters receded, and they have not been flooded since then. So when we had those rain and they flooded and sit there for 7 days, these mosquitoes are coming from Matthew. And so what happens is these mosquitoes are laying eggs now that'll lay dormant until we get another flood. What we're doing as far as the county, we're killing mosquitoes, but we're only killing the ones my product hits. And we have, just to update y'all, we have sprayed the whole county, and we've actually have started over again. Myself, my staff, and Bradley, his staff, we started Tuesday, and I think Bradley sprayed last night also, and East Arcadia again, starting over like we started before. And we like I said, we sprayed the whole county.
So when you say spray the whole county, what do you mean?
Every
Yeah.
road that's in the county except for the municipalities. We don't spray Bladenburg, Clarkton, Littstown, Tar Heel, those that have their own mosquito sprayers.
Now, y'all sprayed every road in Blaine County.
Yes, sir. Whether people know it or not, we're spraying starting at dark and on into 11, 12, 1, 2, 3 o'clock in the morning. Because see, the spray, I can't spray during the day.
You have to spray after 4
The,
o'clock,
pr-
right?
the, well, I've got to spray once the sun starts setting, because I've got to have a temperature inversion for the product that's hanging there. Because the product only kills mosquitoes when it flies through it. There's no residual, it's what it is. So yes, we have sprayed the whole county. We don't go down private roads. There's no way, in all the blue sign roads or long driveways to go to people's houses, there's no way to do all that. And it's a danger to the trucks not knowing what might be on that dirt road.
Mr. Harris, so again, the question on the floor, you never asked that.
I can't say yes and I don't. I've heard people say it works. Mosquito dunks, like I said, we're killing mosquitoes that are flying. The larvicide, the mosquito dunks that we're handing out, they're doing far more than what I can do in a truck in the night. Because they're gonna kill the larvae before they can hatch.
The reason I asked about the Clorox,
Yeah.
I'm just asking, would it be an adverse reaction if you put that Clorox out? So
No.
it's gonna create like a safety hazard for somebody putting it out, that's all we know that.
No, I mean, if you dump a gallon of Clorox in half a gallon of water, then yeah. But if you're dumping a gallon of Clorox over in a flooded area, no.
Okay, that's what I'm sure.
We have the ability to, just to give y'all myself, Mr. Martin, Bradley, and, Steve Willis met on talking about aerial spraying. Before we considered the organics things that are issues in the county, just two prices to spray our whole county, you're looking anywhere from $850,000 to $1.3 million to spray at one time and get 3 or 4 days of relief. That's it. The biggest thing is the tip and toss of people using the dunks that we're handing out like they're meant to be. And then what I've done on not my own, but with what the stuff we have the county has is go down and I actually have larvicide that I can put in a backpack sprayer and blow out into floodwaters. So Friday morning, I rode the back truck, had another guy driving in the Kelly area, spraying the ditches and in yards where the water was still standing. But the problem is, just like other departments, is staffing, is having the time to do all this. So I've already got quotes to order more material so we'll have on hand, to make sure we don't run out. Have talked to Steve Willis about possibly looking at spreading some larvicide in a broad spectrum instead of just like throwing it out whatever. So I've got quotes on that, and then I've talked to Mr. Rayner about if we get this state allocated money, what we could use it for to be better prepared in the future as far as with the program we do have.
Question,
Yes, sir.
exactly what chemical are you using?
It's 4% permethrin and 4%, butyl pyrethroid or something like that. It's a water-based I dump it out of a jug directly into the machines. So, I've talked to the high schools, I try my best to spray when they're having sporting events. Dr. Cross left me a message, I sprayed the soccer field, East Bladen, with the truck Friday morning, and I went yesterday on my own with a backpack sprayer we have and sprayed around the soccer field, the edge of the woods with a backpack sprayer. And I was contacted by Lou Nealon, that's my last name for the school system, about spraying West Bladen today. I called him back and told him, really, I don't have the time because my product has to spray when your people are gonna be there. So I told him, I said, just let me know or let your coaches know when you're having a game that we can get out there and try to spray and help them out. And so,
Appreciate it. I like to say I appreciate it. But I would like to know, will the dungs will help the folks in Kelly, I guess in Glenbrook, they still have stagnant water?
yeah, what you need to do with the dump is, it's not moving or running water, and you don't need to throw them in a pond.
Right.
Pond has fish, they're gonna take care of the larvae, you don't have to worry about pond, it's the stagnant, standing water that's left from flooding. You throw those in there, what we do is, we actually have a label in there that tells you what it is and how to use it. It can actually be broken up in half and thrown part here and part here. But the biggest thing that you're gonna start running into is your tiger mosquito. And that's the one that bites you during the day, and that's the one that breeds in containers. So that's where the message of tip and toss, comes in.
That's spelled D-U-N-K-S? You
Dunk,
said dunks?
like a mosquito, it looks like a donut,
Uh-huh.
but they're called mosquito dunks.
How you spell that last word?
D-U-N-K-S,
Okay.
dunks.
They work pretty good, I put some in.
They, we try our best to supply them. I mean, it's something you can buy at Big Blue, Feeding Garden, you're on your own, but we have 600 ordered that should be here Wednesday. And the state, right now, Bradley requested some from the state, and I talked to the guy today, and out of the 7,000 that they were donated, they're saying we're possibly going, the first distribution going to about 350 of them, so.
Thank you.
One of the things I do want to add about the grant that we are getting from the state, it is a 75-25 match. In order for us to get the 39,000, we have to spend 3 times that, and we can only get reimbursed for 75%, which is the 39,000. The county has to do a 25% match. So just so y'all will know that. No, sir, this is on the money that we're getting from the state to aid us in the mosquito abatement. Yes, sir.
So we got 75%, we pay 25%.
Yes, sir, that is correct. So I did want to throw that out.
When they give us, we got $39,000,
That's the way the agreement addendum is written. The state wrote it that way.
and we gotta give $39,000 for it.
We will get 39,000, but in order to get that 39,000, we've got to expend that plus in order to get that 39,000. Like I say, they're gonna give us 75% back of what we spend up to the $39,800.
I didn't know it was a matching grant like this.
I didn't know.
Yes, sir.
And what we were told.
Can we submit that part that we got to pay, can that be some way, Miss Lisa, to go through, an expense to FEMA?
I'll have to double check. I think there is something in there about mosquito abatement, but I'll
I
have to.
think it is.
The mosquito dunks that we just purchased ourselves that we're waiting to come in on Wednesday, we got an email from Ryan Combs through our PHP and our public health response, that can be submitted on FEMA and get 100% reimbursement on that. But like I say, on this other money, based on the AA and the way the program is written, it is a 75-25 match. And that was told to us the other day on the conference call that we had.
And that state, do it? Or is that-
Yes, sir.
All right, but she can try the federal route.
But with the mosquito dumps that we have just purchased,
But I'm talking
yes.
about on the spray. On the part, we got the 25% match, and we want to see if she can pull
Right.
that off and get that covered.
We don't mention that matching on this thing I got.
It was told to us on the conference call.
I mean, we got a document here that don't mention it. I mean, why, that's what we should go by.
This is the way that the vector control has always worked, has been a 75-25 match. And like I said, that was told to us on the.
Because this is from the state of North Carolina.
We need to request that they revise that agreement addenda to reflect that requirement. We can do
Yes,
that.
sir.
One thing, excuse me, one thing Dr. Cohen did indicate today, and she's actually addressing Mr. Brisson, is that they are planning to seek an additional $3 million. They think that $7 million is the figure that they really need to shoot for as far as mosquito or vector control assistance. And so there may be an additional 75% coming to county as well.
So another, maybe 80,000. Do the 80,000.
Well, Clay, it would be 75%, but another 30. We got 40. If we have 40, it'd be an additional 30, approximately.
The first item we have for you tonight is the agreement with Blade Community College regarding phlebotomy clinical students. This is a renewal contract with us and BCC that allows students who are in the phlebotomy course to complete clinical requirements. This is an annual renewal and is at no cost to the county.
Get a motion.
Motion to approve.
So moved.
Got a motion by Ryan Goins, and we got a second by Mr. Alphabet. Any discussion, all in favor say aye.
Aye.
Opposed?
Our next item is the CST data document imaging conversion. This project is to convert all of our medical records from paper records to electronic medical records. Once we get this project completed, it will be ongoing with our staff at that time, that they will be able to handle the volume. Right now, the volume that we have that needs to be scanned in, we do not have the staff, and this is a one-time expense.
Can I get a motion?
I have a question. Yes, ma'am.
And right now, this cost is this the one that you agreed for?
For $99,500, yes, ma'am. We did our price comparisons
Right.
with 3 bids as consulted with Ms. Coleman.
Okay, that also includes the equipment that.
There is no equipment. Yes,
We
ma'am.
don't take it, it's theirs.
Right, what they'll do is they'll come and pick this box up,
Oh.
they will scan everything in, it will be dropped into a cloud,
Right,
and they will maintain all of our records until we are satisfied that this is scanned in properly and that all the documents are clear and concise. And at that point, they will help us work with a management destruction of those charts.
okay, so do we have electronic record now?
Yes, ma'am, we do.
And so if it's in the cloud, can we pull it down from
Yes,
this?
yes, ma'am, and this is the preferred vendor with the current EMR that